Let's discuss. We're joined by the Children's Institute's Communication and Education Specialist, Laurie Lake. Ms. Lake, thank you for being with us. I guess these things are all linked. Unemployment and poverty, meaning kids are malnourished and at the same time often forced into child labour.
Yes, so if we look at the situation in South Africa, children in South Africa are really faced with a double burden of malnutrition, of both undernutrition on the one hand and overnutrition on the other. So more than 1 in 4 of our young children are stunted. They are short for age, and that is a sign of chronic malnutrition that can cause irreversible damage to the developing brain. And we know that South Africa's stunting rates have remained stubbornly unchanged for the last 20 years. And that's extraordinarily high for a middle-income country. In addition, 1 in 8 of our young children are overweight or obese. And this is more than double the global average. And we also know that overweight and obesity increase rapidly across the life course, affecting 27% of adolescent girls and 62% of adult women. And this in turn increases their risk of developing non-communicable diseases such as diabetes and heart disease. So we start to see how malnutrition in early childhood has this long-term impact on children's health and development. And you're quite right, there's a very strong link between poverty and malnutrition, with over 1 in 3 children in South Africa living below the food poverty line, which was valued at 585 Rand back in 2020. And that's simply not enough to meet a child's nutritional needs. And then on top of all that, we've had COVID-19, which has had a really devastating impact on families as unemployment, or rapidly rising unemployment, was coupled with food price inflation, which made it harder and harder to feed children a nutritionally balanced meal. And now in 2022, of course, we're faced with the impact of the war in Ukraine, which again is anticipated to drive up the cost of both energy and food in South Africa. So we are deeply concerned about children's health and nutrition. We are starting to see anecdotal reports coming in from frontline health workers who are starting to see cases of more severe acute malnutrition, and this is one of the key drivers of under 5 mortality. So we're not just concerned about the long-term impacts on children's education and cognitive development and long-term impact on their health across the life course. We're also increasingly concerned about child survival.
Sure, yeah, and if you think about it, this is young children starving to death, basically, but before our eyes. So 1 in 4 children stunted. Let's focus on the stunted kids. You said it's hard to overcome. Can this be overcome? How does it play out as they grow up?
Well, one of the concerns with stunting is that it's not just that the child is short for age, it's that the developing brain is also in a sense, starved of essential nutrients. And then that starts to impact, obviously, on the child's ability to learn, their education outcomes, and eventually their employment prospects. So there's a concern that undernutrition in early childhood really fuels an intergenerational cycle of ill health and poverty. Yeah. So there's a very strong call coming through in the 2020 South African Child Gauge to intervene early to disrupt this cycle. So providing children with optimal nutrition, exclusive breastfeeding for the first 6 months of life is one of the essential elements we need to put in place. But we also need to be strengthening surveillance systems within health and at community level, so we can start to identify children as their growth starts to falter, so that we can put in place systems early on before the damage is done.
So is enough being done? The sugar taxes there, you spoke about obesity actually linked to eating all the wrong foods. You've pointed out that the idea of a National Food and Nutrition Security Council has not been implemented. And then, of course, we do have the nutritional program at schools, the big fight when it was shut down, when schools shut down. But is that making a big difference?
So the National School Nutrition Program is absolutely essential in bolstering the nutrition of up to 7 million or more children of school-going age. The concern, though, is that stunting, the impact of stunting and malnutrition is felt most starkly by our very young children in the first 2 years of life. Who are not necessarily reached either by schools or by ECD programming. So they really fall under the responsibility of the Department of Health. But also, equally, we need to strengthen our social security system. So if we're looking at 1 in 3 children living below the food poverty line, and we're looking at close to a 50% expanded unemployment rate in our country, then we desperately need to be getting more income into poor households so that they are able to make healthy food choices for their children. If we're looking at the child support grant at the moment, it's valued at 480 Rand a month. That's roughly 16, 17 Rand at the most a day. And it's simply not enough to be able to provide children with the kind of dietary diversity they need, both to prevent stunting and to prevent micronutrient deficiencies. So in many, many ways, we are selling our children short. And we are going to carry the costs as a society for generations to come.
Sure, it's hard to even think about the long-term effects, the situation for many children in this country. Thank you very much. That was the Children's Institute's Laurie Lake.